So the book talks about this at the end of the chapter, and I'm going to talk about it now because I think it makes more sense. So changes in populations over time. So because the ages of people in your population are really important, the numbers of people in any age group that you have over time can change, and that's going to have a big impact on your public health. Okay, so those changes of groups of people at different ages over time, that's part of what's called your demography. So demographics are things like age and sex, those variables that we often track in vital statistics. So what we're looking at right now is an image of the population pyramid from the United States from 2020. So a population pyramid is a way of graphically looking at the population of your country. And so what we have over here on the y-axis is age. So starting at 0 to 4 and going all the way up to 85 plus. Then our x-axis here is 0, and then this is percentage of the population. So this right here is 3%, and then this over here is 3%. So you can see that in 2020, about 3% of population was made up of males between the ages of 0 and 4. And about the same percentage was made up of female-bodied people between the ages of 0 and 4. Then you can see the different age groups. I know it's a little hard to read, the age groups are pretty small, but it goes up in increments of 5 years. And you can see that in 2020, every age group has about the same number of people in it until we get up here. So this is the 65 plus group. And of course, this is when we start seeing most of our deaths. So as we saw before, right, the older you are, the more likely you are to die. And the next year, most people who die in this country are older people. So the population starts falling off then as we age. So I just want to contrast that with the population period from 1960. So you saw in 2020, it was kind of like a rectangle, which might make you wonder why we call it a population pyramid. And looking at this data from 1960, you can see why it's called a population pyramid, because historically people had more than 2 children in their families. So each successive generation was getting bigger and bigger and bigger and bigger. Additionally, people didn't live as long as people tend to live now. So again, if we look, here's that 65 group, but we can see, right, they're starting to fall off and people are starting to die in their 50s in the 1960s. This was before we had a lot of interventions to help prevent and control heart disease, lung cancer, all types of things. So we had a very differently shaped population pyramid back in the 1960s. And so because you have different numbers, different percentages of people in different age groups, that's going to really change what are the most important or most prevalent health conditions for your population. So we're going to look next at an animation of population pyramids so you can see how things have changed over time. So you can see it goes to 1980 and then 2000 and then 2020, and then they're projecting into the future to 2040 and 2060. And you can see that pyramid is changing into a rectangle, and they're assuming that the birth rate is going to stay kind of similar, maybe go down a little bit in the United States. And so this change in shape of the population of the pyramid has a big influence. I'm going to show you one more animation. I like this one because it names the different generations. So, and you can see things actually moving through. As somebody ages, they move into the next bracket, right? So we'll wait for it to reset, and you'll see that it starts at 1980. And here's the baby boomers, right, going through their working years now into retirement, followed by Gen X, that's my generation. We're a little bit smaller. And then millennials, Gen Z, and then future generations, of course. So it's kind of fun to watch this and kind of look at how things have changed over time. So again, I'm going to bring us back to this kind of comparison between 1960 and 2020. Things are very different. I'm going to show you another example. So this is looking at population pyramids between 1975 and 2025. And the thing I want to point out to you here is the percentage of people that are over age 65. So the percentage of the total population. So in 1975, which is a few years after I was born, less than 10% of the population was older than 65 or older. I can't talk, right? But in 2025, that's almost doubled. So more than 18% is actually closer to 19% of the population. I know we're not there yet, but we're almost there. So projecting, barring some mass casualty event, right? So greater than 18% of the population now is over age 65. So this has a huge impact on demand for health services, right? These are the folks that are having a lot of heart disease, they're having a lot of cancer, they're also starting to have dementia. So when we think about the health needs of the population, now we have a much bigger chunk of the population that has higher health needs. So as we talk about our challenges meeting people's needs in terms of healthcare and our healthcare worker shortages, you can start to see why. I also want to take a moment to just say that these demographic shifts also affect our economy. So I looked at the US Census data. I did this before I did this slide, so it's not exactly the same years, but I looked at 2003 and I looked at 2023. And I looked at how many people in the United States were working age, which I roughly calculate, I used 20 to 59, and how many people were retirement age, people who were retired, so age 60 and greater. Now, some people work until they're 70, some people only work till they're 50, right? It changes, but I use 60 just for this thought experiment. And if you look at how many people in 2003 were working age compared to how many people were retirement age, the ratio was 3.4 to 1. And if you look at 2023, the ratio just by ages, right? Not whether people were actually retired or not, although a lot of people retired during COVID because of the hardships that it imposed. That ratio falls to 2.2 to 1. So this is really important, not just in terms of healthcare, right, and public health, but in terms of like the number of workers that we have per numbers of retired people is much smaller, like a third smaller. So these are the people who are staffing our restaurants and our shops and our nursing homes and our schools and all of the other services that we all rely on, right? Our police departments, our fire departments, social workers, you name it, right? Construction, working in industry. And then, of course, these are the people that are also paying into income tax, so your federal tax system, and also paying into Social Security. So when you think about it, you used to have more than 3 people supporting every retired person who is using a lot of those services. Now we only have about 2 people per every retired person contributing in ways, both in terms of what they're doing as an occupation and also contributing financially to support those people. So I wanted to take a moment to talk about this because I don't think we talk about this enough in the United States as we're talking about like, oh, healthcare and Social Security and all these types of things. This is a big reason why all of those things are really challenging right now. So I think it's important to acknowledge and point out. Okay, so in addition to demographic changes within our own country over time, we're also going to see demographic differences when we look at different regions, when we look at different parts of the world, when we look at different countries. So here I decided to just stick with South Africa as an example. They are very different than we are in lots of ways. And here, just looking at this population pyramid, you can see that right away. So you can see that in South Africa, once you get to age 40, right, we see this huge falling off in the population. Now, there are potential variety of reasons for that. It could be changes in the birth rate. The birth rate could have been increasing a lot, creating those bigger and bigger generations, and it can also be because of high mortality rates. And in fact, part of this is because of the very high mortality rate that we see from HIV in South Africa, which, as you saw earlier, is a huge killer of their working age population. And in fact, 2/3 of the population of South Africa is under the age of 40. So if you're a public health worker in South Africa, you're going to have very different things that you're concerned about compared to someone in the United States. It also explains why extrapolating health data from one country to another can often be fraught with difficulty. So during the COVID um, pandemic, right? There were multiple waves of it. When the Omicron variant came through, it hit South Africa before it hit the United States. And they didn't have a lot of hospitalizations and they didn't have a lot of deaths. And so people were really optimistic that when it arrived here in the United States, we wouldn't have a lot of hospitalizations or deaths either, because we thought, well, maybe this variant was less deadly, less serious. But in fact, it ended up being that the reason why they didn't have a lot of death and hospitalizations from that variant is because most of their population is so young. And we know now, we were starting to know then, that the older you are, the higher your risk for severe illness and death with COVID-19. And so unfortunately, when Omicron arrived in the United States, although it did not cause as big a jump in some of the hospitalizations and deaths as some other variants, it still did cause much more of a problem here in the United States than it did in South Africa. So anytime we're looking at comparing health outcomes in different countries, different regions of the world, we have to keep in mind these baseline differences, which may be the demographic differences as one of those things that are different. And then, of course, the total ecology, your social environment, the societal influences, all of those things. So I alluded to the fact that birth rates can change over time, right? What's interesting is that in the United States, for the most part, and most years, we have about 1% of our population that dies. It's usually slightly less. In 2022, we had 3.3 million deaths. In 2021, we actually had over 3.5 million deaths, because that was when we had a lot of deaths from COVID. We didn't have widespread vaccination yet. But anyway, in 2022, we had 3.3 million deaths and 3.6 million births. So you could appreciate then more babies being born than people dying, so our population does increase. But that's a pretty small increase, right? By about 0.3 million or 300,000 people, which is 0.1% of the population. So our population is no longer growing at the same rate that it once did. And that is why in that population pyramid now we're seeing it more of a rectangle than that actual pyramid. And so it's projected that our population is probably going to stabilize. We're about 343 million now, or at least as of this one was 2025, the graph that we're looking at. It's probably going to stabilize a bit above that. Who knows? Who knows what's going to happen with how many children people have? Right now, it's at the average about 1.6, 1.7 per couple. So obviously, that's a little bit less than replacement rates. So it'll be interesting to see what happens over time. And so keep in mind both what's causing death and who it's affecting and what's going on with your birth rate. Those are all going to affect the size and shape of your population pyramid. Another transition, aside from demographic transitions that occur, are nutritional transitions within populations. So what we're seeing on the left-hand side here is images of children that are not getting enough food to eat. So what we often see in developing nations is that there is a very high rate of famine or food insecurity or lack of access to appropriate nutrition. And so famine and starvation and malnutrition are the primary concerns of those populations, because they have huge impacts on the health of the society, of course. And it's really easy sometimes to think, oh, this only happens, this is only starving children in Africa and other developing nations, but also keep in mind that we have lots of pockets of food insecurity and malnutrition even here in our own country. They are just smaller and less prominent than what you see in less developed or less wealthy nations. And then, of course, as a society becomes more developed, becomes more wealthy, then we see kind of the flip side problem. So there's just too much access to nutrition. We see overnutrition, we see obesity rates, and then the diseases that accompany obesity, so things like diabetes and heart disease, start to skyrocket in those populations. So as in many things, balance, right, is of the best. Moderation is best. You want enough good nutritious food and not too much.